Okay, hello everybody. My name is Vanja Mileski, and today I will present you our work on the Parkinson's disease. So I'm that guy Draghi mentioned before in his talk.
No pressure.
So, as you heard before, we are analyzing data from the Parkinson's Progression Markers Initiative. We consider data on 452 patients. On the one hand, we have the fMRIs, which are actually described as regions of interest, and on the other side, we have the motor assessment scores. And so the goal is to find groups of clusters that exhibit similar behavior in terms of these scores. Here, on the left-hand side, we have the regions of interest. On the right side, we have those 35 motor assessment scores. These scores are, for example, speech, facial expression, rigidity, posture, and so on. Now, these scores go from 0 to 4. 0 means that so it's normal, and 4 means severe motor impairment. Now we want to build a model that will predict all of these 35 motor assessment scores at the same time. To this end, we use the predictive clustering trees. As you heard before, they are extension of decision trees with which we can predict structured outputs, and multi-target regression is such task that the PCTs can handle. Now the reason that we want to build a single model instead of building multiple models for each of the targets is this, because with a single model we can exploit the possible interdependencies that are between the scores. And as you've seen in Draghi's talk, here we have a tree. In the nodes we have our regions of interest from the fMRIs. In the leaves we have the number of patients that fall into that cluster. We also use ensembles of predictive clustering trees to boost the predictive power. Now, as I mentioned before, we have 135 descriptive features, so those are the ROIs, and we have 35 target features, which are the motor assessment scores. Now, we have 328 patients, and we have 124 controls. Now, we have 4 different scenarios. First, we can take only the patients, and then we can take both the patients and the controls. And now we can also divide the descriptive features, so the regions of interest, with the total intracranial volume of each patient's brain. So here are the results. We can see that when we have both the patients and controls, we have better results. But when the division with the total intracranial volume doesn't seem to affect that much the predictive power of the model. Now, on the left side, we have an example of the predictions of the model. And what's really interesting here is when we have the model, we can try and we can find some very interesting things. Like, for example, if you look at this group here, there are 15 patients, and we can see that they are all of a uniform gender. So both of these groups are much more of a single gender. Also, we can look at, for example, this group here. Not only that they are of a single gender, they are much younger than the rest of them. For example, the average age is 55, where, for example, here is 67. And not only that, we can also look at on which side of the body the Parkinson's disease manifests. As you know, Parkinson's disease in some patients manifests more on the left side, on the other on the right side. We can see that these patients are much more affected on the left side of their bodies. But for example, this group here, they are much more affected on the right side of the body. We can also see other things like, for example, some patients are more rigid. Others have the disease manifests more in sort of tremors, so they are shaking. And for example, some groups of patients are much more rigid there, for example, then they are have tremors. So if you have any questions, please don't hesitate to come to my poster and ask. Thank you for your attention.